Tell us what we should make of this news about the vice president.
Well, I don't think it necessarily needs to be a headline anymore. We know that the community transmission of COVID is a little bit on the rise with the spread of the BA2 variant or subvariant. But what's nice to see is that we're not seeing a tremendous impact on healthcare facilities. And with the proper use of vaccines and therapeutics, disease with BA2 tends to be relatively mild. And so I think we're in a better spot now than where we were 2 years ago.
Yeah, and to pick up on what you just said, Ms. Harris is fully vaccinated, so we don't need to be too worried about that. At the same time, they may be considering some of the therapeutics you just talked about. The White House has just announced within the last 24 hours that they're going to increase the purchase of Paxlovid. I think that's the way it's pronounced, the Pfizer therapeutic. How important is that in the treatment of this disease?
I think it's very important. The monoclonal antibodies and the oral agents, including Paxlovid, are really important tools that we can use to prevent high-risk individuals who contract COVID from developing severe disease and landing up in the hospital. So more access to these medications for more folks means that we'll be able to continue to control the impact that this disease is having on our healthcare facilities.
So, Doctor, one of the things I'm curious about, and you'd be the right person to ask this question of, on the one hand, perhaps the vice president getting the disease is not necessarily a big headline that it would have been at one point. At the same time, how do we avoid becoming complacent when it comes to getting vaccinated, getting boosted, but also wearing masks, things like that? Are we getting so inured to this disease that we might get a little sloppy?
Well, I think we have shifted in the pandemic to a stage where it comes down to an individual's assessment of their risk, right? So, and it's basically up to each individual person to do the right thing that's will keep them safe, whether that means vaccination, masking in crowded areas, using therapeutics, et cetera, because everyone's risk is different and everyone's perception of that risk is different. And so it's nice to see that we have all of these strategies now to use for people to remain as safe as possible. And when to use those strategies really depends on the level of COVID spreading in the community.
There are a lot of tools that we have. It seems exactly right to me. I wonder if we have the information, we who are not doctors, who are not infectious disease specialists, to make effective use of those tools, because sometimes it can be a little bit confusing. Or is it just necessarily confusing because it's so complicated?
Well, when any sort of new disease or new therapeutics come out, it's always a little bit confusing for the healthcare world to understand what those are and learn how to use them. But I think that the federal government's test to treat program is an example of a way to make these therapeutics more accessible to folks who may not necessarily be linked into healthcare. And there's a lot of education that's being pushed out at both the federal and the state level to healthcare providers to be able to become knowledgeable about these tools so that they can better use them for their patients.
One of the tools we have, I suppose, is home testing. Is that helping us or hurting us at this point? It's nice to know we can get an instant test at home. At the same time, does it make it less easy to know what the overall state of the disease is in the community?
I think the access to home testing has been a great advance in this pandemic. I think individuals are more likely to test when they're symptomatic if it's quick and easy and they're able to do it in the comfort of their own home. I think the metrics that we are using to measure the impact of COVID have changed. And so while home testing may cause an underrepresentation of percent positivity or community transmission, what we're really following now is hospitalizations, ICU admissions. What is the severity of disease? Those metrics are more important, and those shouldn't necessarily be impacted by home testing, because if an individual tests positive and they're sick enough to require emergency room care or ICU care, they will end up in a hospital.
Doctor, finally, this pandemic has been critical at different parts in the world at different times. And right now, China is clearly struggling with it. Is there anything we can learn from how they handled it? Which is not to say we're right and they're wrong, but just that we can learn that will make us more effective.
I think what we've learned so far is again, how to use these different mitigation measures to stop the spread of COVID. And that's going to ebb and flow as the numbers go up and the numbers go down. COVID is here to stay. It's hopefully we're getting into an area where it's becoming more endemic as opposed to a pandemic. But I think, what we can learn is it's important to mask in certain settings. It's important to get vaccinated, and it's important to stay home when you're sick, and get tested. I think those are the basics of COVID control. And those are things that we can continue to do here to try to make this transition from pandemic to endemic.